No one's period is ever the same from month to month. But if you find that your menstrual cycle is causing pain, discomfort, or disruption to your daily life, then it could be because you are suffering from a common menstrual disorder. Common menstrual disorders can be characterized by a variety of different symptoms, including heavy periods, irregular periods, pelvic pain, premenstrual syndrome, PMS, cramping and fatigue. Other symptoms can include bloating, nausea, mood swings, headaches, and breast tenderness. If you are experiencing any of these symptoms, it may be a sign of a menstrual disorder. The cause of a menstrual disorder can vary depending on the type of disorder. For example, a hormonal imbalance can result in heavy or painful periods. Pelvic infection or endometriosis may cause pelvic pain or irregular menstrual cycles. Stress and lifestyle choices can also play a role in the development of menstrual-related issues. For mild or moderate menstrual disorders, lifestyle changes are often recommended, such as reducing stress and exercising regularly. Diet modifications and natural therapies can also be helpful. For more extreme cases, hormone replacement therapy or prescription medications may be necessary, depending on the condition.